Introducing the Elevation PiezoWave 2, manufactured by Richard Wolf, for non-invasive treatment of musculoskeletal pain. The PiezoWave 2 myofascial acoustic compression therapy effectively treats the pain resulting from common soft tissue conditions by utilizing focused sound compression, including soft tissue strains, dysfunction in transitional regions between tendons and muscles, repetitive stress injuries, trigger points, tendinopathy, and myofascial dysfunction. The primary contraindications are infections, tumor diseases, clotting disorders, where it's necessary to check the blood clotting status before treatment, taking of anticoagulant medication, pregnancy, and lung tissue in the pressure wave path. The PiezoWave 2 is comprised of the therapy source, control unit, foot switch pedal, and a unit cart. Connect the therapy source to the control unit. With the power cord connected to the control unit, press the power switch on. To prepare the therapy source, turn the black locking ring counterclockwise and remove. Apply a sufficient amount of the recommended LithoClear gel to the center of the contact surface of the therapy source. Place the gel pad onto the therapy source. Install the twist lock ring and turn it clockwise to lock. Select the gel pad in accordance to the required penetration depth. The number on the gel pad indicates the penetration depth of the therapy focus in millimeters. Using a taller gel pad results in an incrementally shallower depth of penetration. The maximum possible depth of penetration is approximately 30 millimeters, which is achieved by using the highest numbered pad, which is 30, the flattest gel pad. Turn the control unit on. The plus and minus buttons on the left and right side of the control unit control pulse speed and intensity respectively. An iPad fits onto the control unit for protocol reference and patient instruction. To initiate therapy, press the button on the therapy source or press the colored pedal on the foot switch. The foot switch also allows you to adjust the intensity of the pulse up or down.
Acoustic compression therapy actually uses a focused pressure wave to specifically target tissue at a depth that is both anatomically and arthrokinetically correct. So it allows me to get to places where my hands or the tools or other techniques that I've used may not be able to have gotten before.
I've found acoustic compression therapy to be a really useful tool in my therapy clinician toolbox in treating patients with different types of tendinopathies, fasciotomies, also things like patellofemoral pain. The really nice thing about this skill set, this tool, is that it allows patients with fairly high irritability to more fully participate in physical therapy things like strengthening and conditioning and stretching that will ultimately help them get better in the long run.
This tool has been really innovative in sense of a diagnostic way of sensing where their pain and restrictions are of soft tissue and fascia, and I've been able to relieve their pain so that they can return to the stage and functional movement without any further issues.
For cleaning, turn the control unit off and disconnect the therapy source. Remove the gel pad from the therapy source by turning the twist lock ring counterclockwise. Clean the contact surface of the therapy source, the gel pad, and the twist lock ring in lukewarm water under the faucet. Then wipe with a soft cloth and surface disinfectant. Do not use cleaning solvents, scouring agents, or coarse brushes on the surface of the therapy source. Make sure that no water enters the therapy source at the junction of the handle and cord and the plug connector. Check the therapy source and the accessories for damaged, loose, or missing parts. Check the connection cord to the therapy source for possible damage. At the end of the day, the gel pad must be removed from the therapy source. The contact surface of the therapy source, gel pad, and twist lock ring must be cleaned and disinfected using a surface disinfectant. Check all electrical lines and connectors for possible damage and secure connection. The PiezoWave 2. We can go where your hands can't.